My name is Dr. Amy Street, and I'm an investigator at the Women's Health Sciences Division of the National Center for PTSD, which is at the VA Boston Healthcare System. I'm also an associate professor in the Department of Psychiatry at Boston University School of Medicine. I work mostly with veterans who've experienced military sexual trauma. So these are veterans, men and women, who experienced sexual harassment or sexual assault during their military service. One of the things that I think is important is to help providers in the VA figure out how to most effectively help these veterans. VA has instituted a system where every veteran is asked about experiences of military sexual trauma. There are several important reasons why that happens. One is we need to know how many veterans have been impacted by these experiences. Another reason is veterans who've experienced military sexual trauma are more likely to have mental health conditions or physical health conditions which are associated with those experiences. And it's important for medical providers to know about those things so they can provide the best care for veterans. Another reason why it's important for us to know which veterans have experienced military sexual trauma is because those veterans are entitled to free care for any conditions associated with military sexual trauma. But if we don't know that they've had that experience, we can't offer them that care. So it's pretty important that providers and veterans can have honest and open conversations about these kinds of experiences in veterans' past. Unfortunately, if you're a veteran who's experienced military sexual trauma, it can be a very difficult thing to talk about. And it can be particularly difficult if you don't trust the provider who you're working with. So I'm working on a study now that asks veterans who have recently talked to a medical provider about experiences of military sexual trauma about how that experience went. I asked them if they were satisfied with the experience, what they liked about the experience, what they didn't like about the experience, what they would change, and how they thought other veterans would want to be treated in that same encounter. And one of the things that we learned was that women veterans were pretty comfortable in talking about these experiences. We saw a lot more variability among men who had experienced sexual trauma. As I said earlier, these are incredibly difficult experiences to talk about, and I think they can be particularly difficult for men to talk about. But one of the take-home messages from the study is that we need to particularly focus on educating providers who are working with male survivors of sexual trauma. Medical providers want to help these veterans. They want to provide the best care for them that they can, but they may not know exactly how to do that. So I can take the information that veterans have shared with me and go back to providers and say, these are the things veterans like about these conversations, these are the things that veterans don't like about these conversations, and then the providers can adapt their own practices so that they're providing better care for all the veterans who they see. I work really closely with Dr. Susan McCutcheon. She's the National Director for VA of Military Sexual Trauma, Women's Mental Health, and Family Services, and that's been a really valuable part of my research. I'm really passionate about helping veterans who've experienced military sexual trauma, and Dr. Susan McCutcheon is equally passionate about that same subject, but on the operations side of the house. And she and I work really effectively together because I think we realize both of our work is really important if we want to make real change for these veterans. And so it's been fantastic to be able to work together on these issues that matter so much. Working with veterans is an incredibly meaningful part of the work that I do. Research can be really hard. It's tedious at times, it's long. It doesn't always pay off right away, and because of that, you need to have something about the work that you're doing that kind of keeps you going day after day and gets you out of bed in the morning and into the office and working hard. And for me, that's working with veterans. Often in my research studies, there's a small monetary compensation just to thank veterans for the time that they've put into helping me do this work, or for the transportation costs to get into the hospital for the appointment. But time after time after time, veterans say to me, you know, I'm not doing this for the $25. I'm doing this because I want to help other veterans. So they have a real sense of service to each other and wanting to help the next man or the next woman who comes along and make their experiences better. Honestly, there's no way we could do the work that we do without the input of veterans, and it's never stopped surprising me how giving veterans are, how much they want to give back. We just couldn't do this work without them, and the fact that they are so willing to give back is what makes it all so possible.